Hi, everybody. Josh Byerly here in Mission Control, Houston. I'm joined by my friend Ed Powers, who is a flight surgeon here at NASA. And, we talk a lot about experiment work and what the crew is doing. They do quite a bit of human research and things like that on their own bodies while they're up there. But figured, it'd be a good chance to get a flight surgeon in here and actually talk about, what you do, first of all, as a flight surgeon, because it's a whole lot more than I think what people realize. And also, what are some of the difficulties of dealing with a crew member who's not here on Earth? So, first of all, welcome. Thank you for joining us. Talk just a minute about what you do on just a daily basis.
Okay. Well, flight surgeons are kind of critical to maintaining the health status of the crew members by monitoring them, basically. Every day the folks who are assigned to crew members to look out for them, and on a weekly basis we interview them and make sure, for about 15 minutes at a time, make sure they're doing well in orbit. But really begins about 2 years before they launch. The flight surgeons who are assigned to an astronaut basically get to know them very well and help in their training so that they know what to do in a medical emergency on board the space station. They go through various training sessions, including running cardiac resuscitation and go through various simulations. And so this allows us to get to know the crew members very well, and we develop a relationship, a very good working relationship with them, and an amount of trust, that goes along with that.
So talk as a doctor, how, doctors use a lot of their senses, their sight, their hearing, they listen, the touch. You don't have any of that really, one of your crew members 250 miles up in space going around the Earth. So how difficult is that? What kind of challenges do you have?
Well, it's a bit of a challenge, and that's part of the reasons why we developed such a close relationship with them in this pre-launch time frame in the training, is because we get to know sort of what they're capable of doing, and what their experience level is, and how they approach a problem when it comes to medical issues. And so it is a little bit of a challenge, but at the same time, as we get to know them very closely, we're able to trust their eyes and ears, and work with them to try to diagnose any issues that go on. Fortunately, they tend to be extremely healthy when we launch them, which is very helpful, but occasionally something will come about. And of course, we have the luxury once in a while of having a physician astronaut on board.
Right.
And that makes our jobs quite a bit easier.
How much do the crew members do, basically finding out about how their own bodies react to being in space, and what is that going to teach us going on? I mean, is it the more that we investigate it, the more we learn? I mean, is there more mysteries? Because, we've talked about how we've even learned that the immune system reacts differently being up there with no gravity. So what have we learned?
That's true. There's a number of research studies going on associated with universities that are looking at the immune system, and there's a little bit of a decreased immune response when you get on orbit. Tendency to maybe be a little bit more susceptible to getting a cold or something along those lines. Mm-hmm. There are also bone density issues. As you go in microgravity, gravity is not pulling down on the bones. It's not the stimulation there to keep the bones healthy. Right. So we have learned how to supplement that by doing daily exercise, both aerobic and resistive exercise. That seems to be helping to mediate that problem with bone density and muscle weakness. And then, of course, we recently have come across an issue with eyes and vision changes in space. Mm-hmm. That we have gotten a little bit more detailed understanding what's going on there, as far as fluid shifting towards the head. When gravity is not pulling it down anymore, it seems to affect the fine structures of the eye and produce potentially permanent changes in the vision. And so we've been using some instrumentation up there now that hasn't been up there before. Small size ultrasonography to look at the eye. There's also a very high level optical camera that we're going to be flying soon that will be able to take a really good look at the back of the eye and try to assess the issues there. We think it could be related to fluid shifting along with high salt diet that happens to be on the space station due to the fact that the food has to be preserved for a long time up there. And maybe carbon dioxide levels may have something to do with it, so we try to keep the carbon dioxide levels down. There are a number of factors that we're looking at up there that may affect certain situations here on Earth.
How did you get the job at NASA? So how do you go from medical school into being a flight surgeon?
Well, I grew up in the Chicago area, and so I went to medical school at Rush University in Chicago, and I was very interested in surgery and emergency medicine. And so I did a postgraduate training program, first a general surgery internship, and then 2 additional years of emergency medicine, and became an emergency medicine specialist. And it just so happens I've always had a fondness of flying. I started flying when I was 15 with a friend's airplane, and so I was trying to combine those different interests, emergency medicine and flying and space program, and wound up doing another residency program in aerospace medicine, 2-year program in Dayton, Ohio, and eventually wound up at NASA. So I've been working as an emergency physician and an aerospace medicine physician for much of the last 10 or 15 years.
Is it still fascinating to you?
Oh yes, very much so.
Lots to learn.
Yeah.
Well, thanks for joining us, Ed. It's Dr. Ed Powers, one of the flight surgeons here at NASA. If you would like to learn more about all these different types of experiments that the crew is actually doing on a daily basis about, with their own bodies and how the human body reacts to being in space, you can always log on to the NASA website. Just go to www.nasa.gov/station. Just click on research and take a look at Expedition 30. So thanks again, Ed.
Good talking with you, Josh. Take care.